Welcome to another episode of Parenting Reimagined, a show that deals with difficulties parents face while bringing up their children. This channel discusses problems that parents face and deal with by offering effective solutions to these problems. In today's episode, we will look at the problem of eating disorders among children and how to deal with them.
Avoidant restrictive food intake disorder is a very common eating disorder faced by many young kids. Children may develop picky eating habits, lack of interest in food, or aversion to certain foods. Kids with eating disorder may not like smell, taste, color, texture of food. They may develop anxiety of choking, pain, or vomiting. Most kids with eating disorder may be underweight or could be overweight if they are into eating junk or fast food. Kids with normal weight may at times also have issues with eating habits. Eating disorders among children may lead to serious fluctuations in eating habits and could lead to multiple and even life-threatening health problems. Largely, there are three main types of eating disorders are: anorexia, a fear of becoming fat. A condition in which a child refuses to eat adequate calories out of an intense and irrational fear of becoming fat. Bulimia, a condition in which a child grossly overeats or binges and then eliminates the food by vomiting or using laxatives to prevent weight gain. Binge eating, a condition in which a child may gorge rapidly on food, but without taking it out. In children and teens, eating disorders can overlap. For example, some children alternate between periods of anorexia and bulimia. Eating disorders typically develop during adolescence or early adulthood. However, they can start in childhood, too. Females are much more vulnerable. Only an estimated 5% to 15% of people with anorexia or bulimia are male. With binge eating, the number rises to 35% male. Medical practitioners are not sure as to what is the cause of eating disorders. They assume a mix of biological, behavioral, and social factors. For example, young kids could be affected by cultural images that approves bodies that are extremely underweight to be healthy. Also, several children and teens with eating disorders may struggle with one or more of the following problems: distress due to bullying, fear of becoming overweight, feelings of helplessness, low self-esteem. Another major growing cause of concern in today's world is cyberbullying, where children as young as 6 to 7-year-old onwards have to face extreme, harsh criticism on their body type. This leads to struggles with body image and an eating disorder. To deal with these issues, children and teens may adopt an unsafe eating habits. In fact, eating disorders often go together with other psychiatric problems such as the following: hiding or hoarding food, anxiety disorders, mood swings, depression, substance abuse. How to recognize symptoms. Early recognition and prevention are key to treating eating disorders in young children. The signs may be obvious, and these could be one of the below: fear of stomach aches, aversion to tastes or textures, tantrums, excessive bowel movements, worry about body image. Other signs of an advanced eating disorder habit may include refraining from eating, reducing food portions, weight loss, lack of growth, thinning of hair, delay of puberty, constipation or digestion problems. Finally, we must understand how eating disorders can be treated. People with eating disorders are best treated by a team that includes a doctor, dietitian, and therapist. Treatment may include nutrition guidance, medical care, and talk therapy, individual, group, and family therapy. The child might be prescribed medicines to treat psychological issues linked to various kinds of eating disorder, anxiety, or depression. It may be hard for the child with an eating disorder to reach out for help because they may be embarrassed of overeating or of being overweight. Many teens don't get treatment for binge eating until they're older. However, getting an early help is more likely to avoid health issues related to weight gain or weight loss. The main objectives of the treatment are to achieve and maintain a healthy weight, have a healthy eating pattern, increase the variety of foods eaten, learn ways to eat without fear of pain or choking. Doctors may give medicines to improve the appetite or treat anxiety. If anxiety is an issue, the therapist will educate children and families ways to handle concerns around various foods. Most of the treatment for eating disorder can be done at home. Unless the issue of weight loss or gain is severe, where the child may need to be hospitalized for better treatment and care. How can parents help? If your child has an eating disorder, it is best to call your doctor for advice. The doctor can recommend mental health professionals who have experience treating eating disorders in kids and teens. Reassure your child that you're there to help or just to listen. Encourage healthier eating habits by being a good role model in your relationship with food and exercise. Don't use food as a reward. These tips can help your child decrease binge episodes. Don't skip meals. Set a regular meal and snack timetable. The tendency to overeat is more likely if meals are skipped and the child gets too hungry. Practice mindful eating. Encourage your child to pay attention to what they eat and notice when they feel full. Recognize the triggers. Help your child avoid or manage things that trigger binge eating. Healthier ways to manage stress include music, art, dance, writing, or talking to a friend. Yoga, meditation, or taking a couple of deep breaths also can help your child relax. Eating together as a family. Regular exercise regime as a family will feel good and help the child manage weight. Rewards. Encourage your child to try new foods, but do not force them to eat. And reward the child for healthy eating. Since the parents and caretakers play an important role in the child's life, family-based therapy and treatment is normally suggested. Parents should be role models for their children. Parents often feel responsible and blame themselves for the child's eating disorder, and it is important for parents to become more confident and empowered to help their child, leading to a better outcome. It is important that children are made to develop a taste for a variety of foods and a healthy eating habit. It is important that as a parent, if you notice that a child needs professional, please do reach out to medical practitioners. An early detection will go a long way in nipping the issue in the bud. Do not feel shy in reaching out for professional help and discuss your child's mental and physical well-being.
If you liked the video, please ensure to smash the like button and subscribe to the channel for smart parenting tips. Till our next video, stay safe and happy parenting.